Surface disinfection of the floor. Wet cleaning of floors of treatment rooms without the addition of disinfectants is sufficient at the end of a working day. However, targeted disinfection measures are necessary if the floor is visibly contaminated with blood, saliva, or other potentially infectious secretions. Please wear personal protective equipment and observe the occupational safety directives. To disinfect the entire surface completely, first remove any dirt or contamination, e.g. blood or secretion, from the floor. Use a disposable wipe saturated with disinfectant, e.g. FD312 from DÜRR Dental for this purpose, and dispose of the wipe. Then disinfect the surface completely. Observation of the operating instructions, especially the concentration and exposure time, is the prerequisite for effective disinfection. Surface disinfection concentrates must be correctly dosed in accordance with the manufacturer information. Always use the appropriate measure to achieve the correct dose. After immersing the clean mop cover in the disinfection solution, wipe the floor in figure of 8 circular movements with the aid of a mop, applying slight pressure. The entire surface must be wetted. After wiping, throw the used mop cover into the reprocessing bin. This procedure is also known as the cover change method. Never re-immerse used wiping cloths in the solution. This so-called one pail method leads to contamination and inactivation of the disinfection solution. In the classical cover change procedure, the superfluous liquid is absorbed by the new cleaning cover in the second step. Alternatively, you can also perform the two-cover method using disposable disinfection wipes, e.g. with FD312 wet wipes from DÜRR Dental, which you dispose of after use. After all routine surface disinfection measures have been performed, the surface can be used again as soon as it is dry. Observe the recommended exposure times at all times in case of targeted disinfection of surfaces contaminated with blood, saliva, or other bodily fluids, the final disinfection, or in situations involving special risks, e.g. after the treatment of patients with contagious diseases. Ensure that the used wiping cloths are washed and disinfected and then adequately dried. Also clean and disinfect the wiping utensils and store them in a clean and dry location. Provide adequate ventilation during large-scale disinfection. Please note: use biocides with caution. Always read the label and product information before use. Ready-to-use solutions from disinfection concentrates must always be freshly made. A ready-to-use solution cannot be used longer than 1 day. Never add a cleaning agent to a disinfection solution.